Hi guys, so today I'm going to talk about the EKG, and I'm going to try to do little video snippets so that it's easier to digest. The videos are a little bit smaller. So first we're going to just talk about like a general EKG concept. So we have the heart, and the EKG is, as we know, just a way to measure electrical activity of the heart. Remember that it's just electricity, so what you see on the screen on the monitor is just telling us how the electrical system is working in the heart. It does not mean that there is a mechanical response. So what we are looking for is electricity shocking the heart, stimulating a contraction. The only way we know that there's a contraction is to feel for a pulse and look at our patient. So when we talk about EKGs, you always have to have that in the back of your mind that we're just looking at electricity. Okay? That being said, we put the EKG leads on, which is what I'm going to talk about first, and we're really just taking multiple images, multiple shots, multiple angles of the heart in order to gather information. And through research and evidence, we know that certain patterns mean certain things. Okay? So if you have the heart and then you have your leads, you have to have at least 3 leads. And we're not going to get real technical. Remember, I want to make it simple. If you have these 3 leads around the heart, okay, picture this analogy. This is my best analogy, especially when you get into 12-lead EKGs and stuff, which we're not going to do right now. 3 people have cell phones, and they're all taking pictures of the same incident, okay, right? There's an accident on the freeway, or there's a fight in the quad, or whatever, okay? And these 3 people have cell phones, and they're all taking pictures of what's going on. Well, they're all taking a picture of the same thing, but they're all going to see different stuff because they're looking at different angles. It's exactly what we're doing when we're looking at leads, and we're talking about lead 2 or the B lead or whatever lead you're looking at, okay? Lead 2 is the one that most of us like. It's the one that we look at in the textbook. It's the one that gives us the examples, that kind of thing. But it's only looking at part of the heart. Okay? So that's kind of the general concept. In order to put your leads on, and we're talking about like in the hospital or if you're working in a clinic, you're putting the leads on the patient's chest. We all know that the chest should be clean and dry and fairly hairless area. You want to make sure you take off any medication patches, nicotine patch, nitroglycerin patch, that kind of thing. You don't want a lot of lotions or anything on. That's going to give you the best conduction, okay? We don't need to use any gel or anything. You're just going to use the patches that come in the package and attach it to a wire that then attaches to the monitor. So the way that we do this, we have a mnemonic. Everybody does it a little bit differently. I'm going to teach you the way that I know. So whether you have 3 leads or 6 leads, which is kind of the general number, you either have 3, 5, or 6. We don't generally see 12 lead on like a regular tele floor. So 12 lead we're going to leave for a later time. So we're going to say white is right. That's where you're going to start because it rhymes. It's cute. Okay, it's easy to remember. So this is my little person. We already discussed I'm not an artist. So, okay, head, arms, legs, the heart. So this is what we're looking at. So white is right. You're going to put your white patch on the right side of the body. Okay? And then black is opposite white. So it goes across to this side. Okay? And then we do smoke over fire. Smoke is black and fire is red. So the red goes down here. Okay? And then snow on the mountains or snow on the grass. So we're going to put green here. Okay, so that's 4 leads, but now we need a ground, okay? And so all the brown leads go in the middle. Those are your ground. Brown is ground. And so you're going to do your brown here, brown. This was black, okay? So brown, and then if you have more brown leads, these are also your V leads. The brown leads are your V leads, which V1 through V6. They are also your chest leads. Okay, and they're also where you feel the apical pulse. Okay, so if you have 5 leads, then you're done. If you have 6 leads and you're like, well, I have this extra lead, what am I supposed to do with it? You just keep putting them around the chest this way. Okay, like follow the rib, below the rib line, or above the rib line, excuse me. You just follow them along. Okay? And if the woman has large breasts, you have to lift them up and place the patches underneath. So white is right, and that's where we start because that rhymes. And then black is opposite white, smoke over fire, snow over the grass or snow over the mountain. Brown is ground, and that goes in the middle. And so you put your first one kind of where you feel your apical pulse or hear your apical pulse, and then you keep adding your ground leads till you run out of leads. Okay. Also, you're going to have on the little patches, everything has instructions. So whatever equipment you're working with, whether you're familiar with it or not, look at it. It has markings on it. And it will say right arm, left arm, right leg, left leg. Okay? So, and then, so those are what your leads will tell you. Okay, so that's kind of what we're talking about when we're putting on leads.